Are you already taking vitamin B12 but still feeling tired, weak, foggy, or unsteady on your feet? Maybe someone told you B12 was the answer for your low energy, your tingling feet, your numb hands, or that strange sense that your legs do not feel as dependable as they used to. So you bought a bottle. You started taking it every day. And yet, weeks later, you still do not feel like yourself. If that sounds familiar, I want you to hear something very important right away. The problem may not be B12 itself. The problem may be that you are taking it the wrong way, in the wrong form, at the wrong time, for the wrong reason, or with the wrong expectations. Hello, I'm Dr. Adrian Keller, and in today's video, we're talking about one of the most misunderstood supplements in all of senior health, vitamin B12. This matters tremendously after 60 because B12 plays a central role in energy, nerve support, balance, mental clarity, and oxygen delivery. But it is also one of the easiest vitamins to misunderstand. Many seniors think, if I take B12, I'm covered. But the truth is much more complicated than that. Because after 60, it is not only about whether you take B12. It is about whether your body can absorb it, whether you are taking the right form, whether you are taking too little, whether you are taking it consistently, and whether B12 is even the real issue in the first place. So today, I want to walk you through why B12 matters so much after 60, why so many older adults still struggle even while taking it, the most common mistakes people make, what symptoms may suggest a real B12 issue, and what to do instead if you want to support your body more intelligently. Let us start with the simplest question of all. What exactly does B12 do? Think of vitamin B12 as one of the body's quiet master helpers. It does not usually get the glamour of flashy supplements or trendy nutrition claims, but it is involved in some of the most important systems that keep older adults independent. First, B12 helps support healthy red blood cells. Red blood cells are the delivery trucks that carry oxygen through the body. If they're not made properly, your tissues do not get oxygen as efficiently. That can leave you feeling tired, weak, and mentally slower than usual. Second, B12 helps support the nervous system. Your nerves are like electrical cables. They carry messages from the brain to the muscles and from the body back to the brain. B12 helps support the protective covering around those nerves, almost like insulation around a wire. If that insulation becomes weak, nerve signals become less clean. That is one reason B12 issues can show up as tingling, numbness, burning feet, weak legs, or poor balance. Third, B12 matters for mental clarity. When the brain is not getting proper support, people may feel foggy, slow, forgetful, or just not as mentally sharp as they used to be. Fourth, B12 influences energy more deeply than people realize. Not the fake wired feeling of caffeine. Real cellular energy. The kind that lets you get out of a chair more confidently, walk more steadily, think more clearly, and feel more like yourself. That is why B12 matters so much after 60. It sits at the intersection of nerves, blood, energy, and function. But now we come to the real problem. Many seniors are already taking it and still not feeling better. Why? There are several reasons. The first is that taking B12 does not automatically mean absorbing B12. This is probably the single biggest misunderstanding. When people are younger, B12 from food is often absorbed more efficiently, but after 60, the process often becomes much more fragile. To absorb B12 properly from food, the stomach needs enough acid, and the body needs something called intrinsic factor. Intrinsic factor acts almost like a transport assistant. Without it, B12 cannot be absorbed properly in the digestive system. Now here is the problem. As people age, stomach acid often declines. That means B12 may not be released from food as effectively. Intrinsic factor may also become less efficient. So even if an older adult is eating meat, eggs, dairy, or fortified foods, the body may still not be getting enough usable B12. That means you can be eating the right foods and still be low. And then there is medication. Many older adults take acid-lowering medicines for reflux, heartburn, or stomach protection. These can reduce stomach acid further. Metformin, a very common blood sugar medication, is also known to affect B12 levels in some people over time. So the combination of aging plus medication can quietly create the perfect setup for low B12. This is why so many seniors say, "But I eat well, so how could I be low?" The answer is often not intake. It is absorption. Now let us move to the second reason people struggle. They take the wrong form and assume all B12 works the same way. This is another very common mistake. Many people think B12 is just B12. They see methylcobalamin, cyanocobalamin, lozenges, tablets, sprays, capsules, and they assume the body experiences them all the same. It does not. Now I do not want to overcomplicate this. The goal is not to turn you into a chemist, but the form matters because some seniors absorb certain types and delivery methods better than others. Some people do better with sublingual forms that dissolve under the tongue. Others may do fine with oral forms if absorption is still reasonable. And in cases of true deficiency or absorption trouble, injections may be needed. The point is simple. If someone has a true absorption problem, swallowing a random pill and hoping for the best may not solve much. That is why I never like the casual attitude of, "Just grab any B12 off the shelf." The body after 60 deserves more care than that. The third reason people struggle is inconsistency. This happens all the time. A person takes B12 for a few days, forgets for a week, takes double the next time, then stops, then starts again. Or they only take it when they feel tired. That is not how supportive nutrition works. If B12 is truly needed, regular support matters much more than random bursts. Imagine trying to water a plant by flooding it once every 2 weeks and ignoring it the rest of the time. That is not steady nourishment. The body does better with consistency. The fourth reason is expectation. Some seniors take B12 and expect an immediate surge of energy by tomorrow afternoon. Then when that does not happen, they assume it is useless. But if B12 levels have truly been low for a while, and if nerves or blood cells have been undersupported, the body may need time. Support is not the same thing as instant transformation. That does not mean B12 never helps quickly. Sometimes people do notice a difference fairly soon. But many expect a dramatic overnight shift when what the body really needs is steady rebuilding over time. The fifth reason is that B12 may not be the only issue. This is extremely important. A person may have tingling feet and assume B12 is the answer. But maybe blood sugar is part of the problem too. Maybe circulation is poor. Maybe vitamin D is low. Maybe the person is dehydrated. Maybe sleep is awful. Maybe the legs are weak from inactivity. Maybe several problems are overlapping at once. This is why B12 can be helpful and still not feel like enough, because sometimes it is one piece of the story, not the whole story. There is another reason so many older adults get confused about B12, and it has to do with how slowly deficiency can show up in real life. Very rarely does a true B12 problem arrive all at once in a dramatic way. More often, it enters your life quietly. It begins with little things, things you can explain away, things you can rationalize, things that are easy to blame on stress, age, or a bad week. At first, maybe you just notice that you are getting tired earlier in the day. You still do everything you need to do, but it takes more effort. Then perhaps you begin feeling a little less steady when you first stand up from a chair. Not enough to scare you, but enough to notice. Then maybe your feet start tingling at night, especially when the house gets quiet and you finally have time to pay attention to your body. Or perhaps your memory feels a little slower, not dramatically worse, just less sharp than it used to be. A name takes longer to come back. A word gets stuck on the tip of your tongue. You walk into a room and forget what you went there to do. The danger is not just the deficiency itself. The danger is how easy it is to dismiss the symptoms while they are still mild. This is one of the reasons B12 problems can linger for so long in older adults. The symptoms do not always feel urgent enough to force action. They are subtle. They build slowly. And because they often overlap with what people think of as normal aging, many seniors live with them much longer than they should. I want you to think about how many times older adults hear phrases like these. That's just part of getting older. Of course your energy is lower now. You're not 20 anymore. That happens to everybody at your age. Now, of course, aging is real. I am not here to pretend otherwise. But there is a very important difference between natural aging and a body that is under-supported. Aging may change the body, yes, but nutritional problems, absorption problems, and nerve-related problems are not the same thing as simply being older. And if you call everything just aging, you can miss opportunities to improve how you feel. Another thing that makes B12 confusing is that symptoms do not always stay in one category. People often think deficiencies should be neat and obvious. They expect a nerve issue to look only like tingling. They expect an energy issue to look only like fatigue. They expect a mental issue to look only like brain fog. But the body is more connected than that. A low or poorly utilized B12 state may affect several systems at once. That is why one person may complain mostly about burning feet, another about poor memory, another about weak legs, and another about exhaustion. They may all be expressing a related underlying support problem, but because the symptoms look different on the surface, the connection gets missed. This is also why older adults can end up seeing several different explanations without anyone putting the full picture together. One person gets told to walk more, another gets told to sleep better, another gets told to take magnesium, another is told the balance issue is just age, another is told the fatigue is probably stress. And meanwhile, the deeper question of B12 status, absorption, and nerve support never gets fully addressed. There is one more thing I want you to understand, because it affects so many seniors and creates a lot of unnecessary fear. Symptoms that involve nerves can feel emotionally unsettling in a very specific way. If your knee hurts, you understand pain. If your back is stiff, you understand stiffness. But tingling, numbness, buzzing, or that walking on cotton feeling can feel mysterious. It can make you worry that something is seriously wrong. It can make you feel disconnected from your own body. And when your body starts feeling unfamiliar, confidence often drops very quickly. That is why B12 conversations matter so much for independence. When the feet do not feel normal, people walk differently. They become more cautious. They may stop going out at night. They may hold on to furniture more often. They may avoid stairs. They may walk less because they no longer trust their body the same way. Then, because they move less, their muscles weaken more. Balance gets worse. Circulation slows down. And now, what may have started as a nutritional or absorption problem begins turning into a mobility problem. This is how small symptoms can quietly turn into bigger life changes. And this is why I want you to take these signs seriously, without becoming afraid of them. Fear freezes people. Understanding helps people act. So if you are someone who feels tired, a little unsteady, a little foggy, a little numb, or a little less sharp than you used to be, do not automatically assume the body is simply declining in some irreversible way. It may be asking for more precise support. Another overlooked point is that B12 status can become even more important during periods of stress or recovery. For example, after illness, after poor eating, after long periods of inactivity, or after months of digestive problems, the body often becomes even more vulnerable. A person may have been barely managing before, but then something stressful happens, and suddenly the fatigue, the leg weakness, or the numbness becomes much more noticeable. That is not always because the illness created a whole new problem. Sometimes it simply exposed a weakness that was already there in the background. This is why so many seniors say things like, "I was managing okay, and then after that cold, that stomach issue, or that stressful period, I never really bounced back." The body's reserves matter, and B12 is part of those reserves. I also want to speak to the people who say, "But my doctor never mentioned B12, so maybe it's not important." Please do not make that assumption. Doctors have many things to think about in a short appointment. If you do not specifically bring up your numbness, your weak legs, your fatigue, your burning feet, your balance issues, or your concerns about absorption, the conversation may never go deep enough. That does not mean your symptoms are unimportant. It just means you may need to speak up more directly. That is why I often encourage seniors to stop going into appointments with vague phrases like, "I'm just tired," or "I guess I'm getting older." Instead, say things like, "My feet are tingling at night. My legs feel weaker than 6 months ago. I feel less steady in the dark. My memory feels foggier. I'm taking B12, but I do not feel different. Could absorption be part of this?" Those are much more useful sentences. They move the conversation forward. And perhaps the most important thing I want you to remember is this. If B12 is part of your problem, finding that out early matters. The sooner a real support issue is recognized, the better chance the body has to respond well. Waiting too long does not make the body stronger. It only gives the symptoms more time to become your new normal. So please do not normalize things that your body may be trying to report. Tingling is information. Fatigue is information. Weak legs are information. Brain fog is information. Poor balance is information. Your body is speaking. The goal is not panic. The goal is translation. Now let us talk about the symptoms that should make you take B12 more seriously. One of the most classic signs is numbness or tingling in the feet or hands, especially when it comes on gradually and keeps returning. Another sign is weak legs. Not just tired legs, but a subtle sense that they do not feel as strong, steady, or responsive as they used to. Balance changes are another important one. Some seniors describe it as feeling less sure of the ground, especially in the dark. Burning feet at night can also fit the picture, particularly when other nerve-like symptoms are present. Fatigue is another major clue, especially if it comes with a pale look, low stamina, or mental fog. Brain fog itself matters a lot. Trouble concentrating, slower thinking, feeling mentally dull. Shortness of breath with activity can sometimes be part of the picture too, because B12 affects red blood cell health, and that influences oxygen delivery. Then there is mood. Some people with low B12 simply say, "I don't feel like myself anymore." These symptoms do not prove B12 deficiency by themselves, but they do make it worth paying attention. Now let us talk about one of the biggest mistakes of all. Mistake number 1. Taking B12 without knowing whether the body needs it. I know that sounds strange because I have just spent all this time explaining how important B12 is. But importance is not the same as assumption. Some people do need B12. Some people desperately need it. But some people take it blindly without ever checking whether it is actually part of their problem. This is where testing becomes valuable. If someone has nerve symptoms, fatigue, weak legs, balance changes, or mental fog, it is reasonable to discuss B12 with a doctor. It is much better to know than to guess. Guessing may lead to false reassurance or wasted effort. And I want to say something that matters here. If you are taking B12 and still struggling, that is not always proof that B12 is useless. Sometimes it means the dose is wrong, the form is wrong, absorption is poor, or another cause is also present. That is why you need clarity, not just supplementation. Now let us go through the most common B12 mistakes older adults make, because this is where many people quietly lose progress. Mistake number 2, assuming food alone is enough. In younger years, maybe it was, but after 60, that assumption becomes less reliable. As we discussed, stomach acid and intrinsic factor often decline. So the issue is not always, am I eating B12 foods? The issue is, can my body still get the B12 out of those foods and use it properly? That distinction changes everything. A senior may proudly say, I eat eggs every day, or I eat meat regularly, and still have signs of poor B12 status, because absorption is the hidden problem. Mistake number 3, taking it at random times with no routine. Supportive nutrition works best when it is not chaotic. If B12 is being used as part of a true deficiency support plan, consistency matters. It should not be treated like a rescue pill for bad days only. Again, the goal is not panic dosing. The goal is steady support. Mistake number 4, ignoring the medicines that affect B12. This is such a major one. Long-term acid-lowering medicines can interfere with absorption. Metformin can contribute to lower B12 over time in some people. And many older adults stay on these medicines for years without anyone ever revisiting how that may affect nutrient status. This is why supplement conversations should never happen in isolation from medication conversations. Mistake number 5, expecting B12 to fix symptoms caused by something else. This may be the most frustrating mistake because it often leads people to conclude that nothing works. A person has burning feet. They take B12. The burning remains. So they say B12 doesn't work. But what if the real driver was unstable blood sugar? What if circulation is part of the problem? What if inactivity is worsening leg weakness? What if sleep deprivation is causing the fatigue? What if B12 is helpful but not enough by itself? This is why the body deserves a wider view. Now let us talk about what seniors should do instead. The first step is to respect symptoms early. Tingling, numbness, weak legs, balance changes, or unexplained fatigue deserve attention, not dismissal. The second step is to ask better questions. Not just, what vitamin should I take? But, could B12 be part of this? Could my medications be affecting my levels? Is this about absorption? Do I need testing? Is blood sugar or circulation involved too? The third step is to think in terms of support, not miracles. If B12 is truly low, support may help. But the best results usually come when B12 support is combined with better hydration, better blood sugar stability, more walking, better protein intake, and a broader effort to protect the nerves and muscles. The fourth step is to simplify. One thoughtful, targeted routine is better than 5 random supplement decisions. The fifth step is to be patient enough to let the body respond. Nerves do not always recover quickly. Energy does not always improve in one dramatic wave. Stability sometimes returns gradually, and that gradual improvement still matters. Now, let me say something encouraging, because I know many seniors feel discouraged when they hear about deficiency, absorption problems, or nerve symptoms. They feel as if their body is becoming more complicated than they can handle. But I want you to remember this. The body is not becoming impossible. It is becoming more specific. It needs more thoughtful care now. That is all. That means what helped at 40 may not help at 70. That means you can no longer assume good enough without checking. That means the body rewards attention more than guesswork. And that is not a bad thing. It is simply a different season of life. I also want to say something about independence. B12 matters because the symptoms it influences are not minor annoyances. Tingling feet affect balance. Weak legs affect walking. Brain fog affects confidence. Fatigue shrinks daily life. When those things improve, even modestly, the effect on independence can be huge. If you feel steadier on your feet, that matters. If your mind feels clearer, that matters. If your body feels less drained, that matters. If you trust your legs more, that matters. That is why this conversation is bigger than one vitamin. It is about protecting function. Before we finish, let me give you a practical summary. If you are over 60 and worried about nerve symptoms, fatigue, weak legs, or poor balance, vitamin B12 deserves your attention, but use it wisely. Do not assume that taking a random pill automatically solves the problem. Do not assume food alone guarantees enough. Do not ignore medications that may interfere. Do not use it inconsistently. Do not expect it to fix every symptom if the real issue is broader. Instead, pay attention, ask better questions, use testing when appropriate, support the body consistently, and remember that B12 is strongest when it is part of a smarter overall strategy. Before we finish today, I would love to hear from you. Tell me your age and where you're watching from. And tell me this, are you already taking B12? If so, why did you start? Fatigue, tingling, weak legs, brain fog, or something else? And have you actually felt a difference? Or are you still trying to figure out whether it is helping? I read your comments, and they help me understand exactly what this community is going through. And let me leave you with this. B12 is not just another vitamin. For many older adults, it is one of the body's quiet foundations. It supports nerves. It supports oxygen delivery. It supports clarity. It supports strength. And after 60, it deserves far more respect than many people give it. You are not weak because your body needs different support now. You are simply in a season of life where precision matters more than assumption. I'm Dr. Adrian Keller, and it has been a pleasure spending this time with you today. Keep listening to your body, keep asking deeper questions, and keep choosing the kind of support that protects your energy, your nerves, and your independence. I look forward to our next conversation. Until then, take good care of yourself.